you don't know. Those times when you have bad mojo, or when you fall and you're fine. You might fall and you're not fine. You might break 2 vertebrae in your back. You might have been that close to death. So you don't know. But on a more conventional way, when I first went to university, I was 18, went to McGill in Montreal from Ottawa, was extremely excited about it. But I'd been sick for a long period of time leading up to it. They thought I had mono, and that I was probably over it. Went to university, and on the first night, I had a massive internal hemorrhage. It turns out I had Crohn's disease, which is an inflammatory gastric disease. And I almost died. They had to rush me into surgery for emergency surgery. I think I was wandering on campus, dizzy, out of blood, falling down hills, sort of thing. Essentially got rescued. And I remember I was really excited because there was a big party the next day that was billed as the Lose Your Virginity party. And I still had my virginity. And I very much wanted to lose it and expected I would. But I was in a hospital bed. And remember also my aunt and uncle sent a clown with balloons to cheer me up one day. And I've always thought that was a really corny thing to do. And so this poor bastard clown suit comes in with balloons to cheer me up. And I just burst into tears and turned away. Because at that moment, I realized how sick I was. Like how sort of pathetic, how close it had been. And truth be told, I'm 52 now. And it's not until this year, really, that my father, who's still alive, told me just how close to death I was. In terms of the blood counts, what I was at and what the doctors were saying. Because I don't remember a lot of that. But I do remember getting wheeled to surgery. And a friend of mine happened to be there. And he was asking me how I felt. And I was drugged up. And I kept saying, I feel great, man. I can run a marathon. I can run a fucking marathon. I feel great. And my only concern was that I was going to have a scar on my abdomen because I had just bought new bathing trunks from Harry Rosen that I thought was the highest status there was. And girls would like me because of my Harry Rosen bathing trunks, and the scar would ruin everything. So that's the first medical situation when I was close to death. And I can't say I had any unique consciousness about it or awareness of it. It was a very dramatic crisis, very critical, but it was resolved quickly. So there wasn't a lot of time to think about it. And then later in my life, I seemed to have medical crisis every 10, 15 years. I was diagnosed with advanced cancer. It was a Hodgkin's disease, which is a cancer in the lymphatic system. And mine was advanced and very, very symptomatic. I was convinced at the time I had AIDS because of the surgery I had in Montreal for Crohn's disease. At the time, AIDS was a big thing, and they didn't test the blood yet. And I was convinced, because I had so many blood transfusions, Thomas blood, that I was going to have gotten AIDS from the 14 transfusions that I received. That wasn't the case. But that was my concern. I thought I had AIDS, so I was actually relieved when I was told I had cancer. And they treated me with chemotherapy and radiation, and I did well. But they couldn't get rid of the cancer. They removed a lung, my left lung, gave me a temporary ostomy, which is where you shit into a bag. It's attached to your body, because I had Crohn's disease. And that was like an open infection. And then they gave me a stem cell transplant. My weight was reduced to like 50 kilograms probably. And when you're having the stem cell transplant, it's a little bit touch and go, fevers and stuff. But I survived that, and it was fine. But I was very conscious that I was close to death throughout. And the one thing that sustained me, and this is just a sort of a weird act of faith. It's like the internet was just coming into being there. And I just started chatting, going into chat rooms. And I met some woman, and we developed a relationship. And she was studying to become a doctor. She lived in the States, had a family, and I was, of course, a patient. And we wrote letters to one another about the experience of being sick and her treating people. And it became a love affair. And I focused like a laser on that as something to live for. Like, if not meeting this woman, loving her, then this correspondence, which to me was extraordinary, would make a phenomenal book. But it was something that I always pointed toward. But I was probably pretty depressed at the time as well. And, I knew I was in trouble. One thing that was very strange about that, too, is I remember one day I was in some emotional distress. I was spending a lot of time in bed because there's nothing to me. And I was crying. And my parents' cat came into the bedroom. Her name was Rose. Obese, a diabetic cat. She had injections every day. And I'm lying in bed crying. Cat comes into the room, sits on the floor, looks up at me, and just starts meowing, like repeatedly. And this is completely out of character for the cat. Like, it makes no sense. She'd never done that to me before. And I'm like, Rose, what's the matter? What's the matter? And in so doing, concentrating my attention on what was the matter with her, I stopped crying. Like, I pulled myself together in this moment, thinking, the cat needs help. And as soon as I was okay, which was quite quick, because I was really confused by this, the cat just left. It's like it heard my distress cries. It came in, alleviated them, and left. So I'll always be grateful to that cat for that moment. And the next time that I came into close contact with death, and this one's a little more intimate, I guess, it was like 3 years ago.
He had a heart attack in Ottawa when he was visiting his mom and dad. And I remember getting the call or texts even from him, I might be having some heart problems, I don't know. I'm going to go to the hospital, and do I come? Do you want me to be there? He's like, just wait, I don't know what's going on. And so I remember these sort of texts going back and forth. I was getting texts from his sister, from him. I remember him telling me, that what he was feeling. He was feeling clammy and breathless, and thinking that he should go to the hospital. And I think he went by ambulance. And so it was all sort of up in the air. I didn't know what to do at that point. And so it wasn't until probably later that night that he texted me. He was like, I had a heart attack. I was like, Jesus Christ. I was like, holy shit.
Apparently all the treatment I had for cancer, radiation to the chest, the chemotherapies, stem cell transplant, damaged the heart quite severely. I didn't know that was a side effect, but it was. And so my heart was ruined from that treatment. And the doctor said there was nothing to be done for it. That palliative measures, they just try and keep me comfortable, was what the course of action was going to be.
Basically put him to palliative care. Maybe he has 3 months to live, maybe 4. They didn't know, but they thought it too much of a risk. So how do you deal with that? How do you respond to a situation where your husband is young, 50, not even 50, in his 40s? You have a baby on the way, and you're left with that.
My wife at the time was 6 months pregnant.
I was going to give birth in 3 months. And so knowing your husband's going into heart failure is a pretty scary thing. You come all this way to, build a life, to get pregnant, and that might all be taken away from you. So that was a hard time for sure. So after, he had many doctors on his case, because he had radiation to his chest for Hodgkin's lymphoma in his 30s, and I think he was 29, 30. They were scared to do surgery on him.
But there was one doctor,
a doctor named R.J. Cusimano.
For anyone who's looking for a good cardiologist, a cardiac surgeon, who said he'd take it on. And he was a religious man. And we went in to see him. We were both trying to get our heads around the situation, because it didn't seem possible to me that they wouldn't do surgery, that they'll do something for me. I'm still relatively young, in my 40s, and got a wife. I've got to be salvageable. We said to this guy, well, what can we do? And he said, pray. Pray. And Rachelle, my wife's family, is very religious, and they certainly prayed. But I'll get to that in a minute. But the doctor, Cusimano, wanted me to wake up at the end of the tunnel, so to speak, where I had a son, and to experience that. So he decided he'd do the surgery so that I might see the great benefit of a child. And Jones, who shouldn't see this for many years, we must make sure of it, was the product of a donated sperm. Rachelle and I had tried in vitro fertilization a couple of times unsuccessfully. And this again is due to all the cancer treatments I received, which reduced my fertility to nothing. And at the time, my health wasn't great. And I had never been motivated to be a father, never expected to be, never wanted to be, or the father of a child from a sperm donation, which there's no genetic link. But the way it works out, both literally and figuratively, Jones saved my life. Without him, without his potential, without Rachelle being pregnant with him, the doctor wouldn't have done surgery. There are no doctors who would have done surgery on him. I would have died. And so that fact had this mystical, profound effect on my life. And I was somewhat unwilling to have a child. Sort of like, oh, well, my wife wants it. She deserves it. I don't know what it'll be like. I'll do it. But all the time thinking, I don't really want to do this. This is going to be very, very difficult for me. Anyhow, performed surgery. It was like an 8-10 hour surgery. There were a number of problems and stuff. Got through it. And this is before a heart attack and stuff. Lots of other strange events. And when I woke up, I remember they had some sort of mask on me for breathing, an unusual thing, and I couldn't speak. And, they were asking me questions, and I was trying to communicate. I don't know what I was concerned about at the time. I might have been concerned about whether I had cancer. It was something kind of irrational. And the only way I could communicate it was to write it. So I was writing it on slips of paper. It's writing so tiny, you couldn't even read it. It was a strange thing. But then I was in the Toronto General Hospital for 2 weeks or so, let's say. And it was what I would call a liminal state. If it's liminal, you're right in front of a threshold. It felt like I was in a bit of a limbo. That the space between realms had grown thin. That's the way it felt to me. That I was in an in-between place. I was alive, yes, but I felt like I had one foot in another world. And things began to feel very mystical to me. I remember at the time, too, the way I looked at the whole event was as a hero's quest. That the point of me living was to be present when my son Jones was born, was to sort of catch him. And in order to do that, I had to accomplish all these heroic tasks. And then surviving the surgery, like passing this test to allow the surgery and stuff. And that was the line that focused me. The weird thing, or one of the weirder things, is Rachelle's sister Rebecca is very spiritual. Family's quite religious. And she prayed a lot for me. And one time when she was praying, she had a vision of the Archangel Michael. Came to her and she described this angel and what it felt like and how immense it was. And all this love and tenderness that radiated from it.
I've never experienced anything sort of religious to that extent, and my sister told me that she had seen the angel over Michael's bed before he went into surgery, and that the angel told Rebecca,
Michael's going to be okay, but he has to keep fighting. And then left.
But I remember her at one point in the waiting room becoming overwhelmed, and she started crying and left because the angel had come to her again to tell her that Michael's heart started beating. And I remember telling me, I'm like, what the fuck? I'm like, why am I thinking about planning his funeral? And you're getting these, like, you know, prolific messages from a spirit that I can't see, but you can. I was like kind of mad. I was like, I'm totally getting ripped off here.
And I just sort of thought, well, that's weird. I didn't really believe it, not literally, but I thought it was weird. Like, she wanted me to be well so much that she hallucinated it or whatever. Like, who knows what it was. But after that had been relayed to me, I started seeing evidence of angels. Like, I would see the name Michael. I would see wings where I wouldn't before. I was probably just hyper-perceptive of it at that point, or motivated. But I did see it. I see it more and more. And we asked the angel, it feels weird saying this, I told Rebecca what time my heart had started. That's how it went. It's like the angel comes to Rebecca, comes there and says, he's going to be okay. His heart is functioning under its own power now. But he's going to have to keep fighting. And we told the doctor this, the surgeon. He was a religious guy. And we asked him,
what time did Michael's heart start beating again?
And he told us. And it was the same goddamn time as Rebecca had reported to us through this angel. So it's such a big mystery in my life. And so angels, particularly the Archangel Michael, is a potent symbol to me. One that I certainly don't understand. But it's a part of my story.
And that I might be having to plan his funeral and then have a baby without him. So that was very hard.
You know, I felt horrible for Rachelle and what I thought was going to be my fatherless son. But I also had a lot of faith that they'd do well, because my wife is such a strong, determined person. But I didn't fear death, you know, because we're all here doing the best we can with what limited tools we have. Like, we're all going to fail. It's good and evil in everyone. You know, you're going to have petty things you do that you regret, or even larger things. But that's the human condition. And I just couldn't imagine an afterlife where people are punished for their limitations. So I had no fear about dying. And certainly it would have been a relief in some ways. Like, now I'm on oxygen most of the time. You know, I'm not as robust stuff as I was. But life is great. So I'm a very, very lucky person. And in each of these circumstances and more, I do think of myself very sincerely as incredibly lucky. Like, I've had a great life. Got to know great people, do great things, have a great family. So, like, these were all sort of miracles. But I guess this is the last thing I'll say. I'm sort of rattling on here. Forgive me. But after a miracle takes place, and you can call whatever you want a miracle, like passing a test is a miracle if you're not prepared, or, swerving away from that deer, or getting the girl, or whatever it might be. So this miracle takes place. It actually includes an angel, in a genius doctrine. My heart is repaired, and my son is born, and I'm there to cut the umbilical cord. Like, that's extraordinary. There's life in the shadow of the miracle. Because you get better, you're saved. You're concentrated on getting better. You get better. And then life returns to normal-ish. And you don't feel quite like you did before. Few things are diminished. Or there might be a weird depression.
Yeah, there was depression, and rightfully so, but it's not even necessarily just a clinical depression. It's like apparently pieces of cholesterol dislodge from the heart after a heart attack, and they go to the brain, and they actually change the chemistry in your brain. So there's not a lot you can do about that. And so he definitely struggled with a depression for a good year.
I was certainly depressed after the surgery. You think, why? A miracle just saved your life. You've got this baby boy, like, you should be ecstatic. But I wasn't. I was depressed. So there's still challenges. And once you go through that door, where something extraordinary happens to you, it does change you, usually very much for the better. But in some cases, it can diminish too. Because you're not the same after the surgery. Some things get taken down. So there are challenges.
I found myself kind of burnt out. Like, there's something called caregiver's fatigue. And there wasn't a lot of support in the city. There wasn't a group I could go to and talk about it. There wasn't a lot of support at all. In fact, there was only like one cardiac psychiatrist in all of Toronto. And so, yeah, that struggle sort of continued for a good year after the surgery. You want to spend that time being grateful for his life, but then you're fighting a new battle. You're fighting, the depression and then the rehabilitation and a new baby. So we survived. We're just a little more tired.
It's hard for me to conceive of a universe in which I'm essential enough that something supernatural would have to come and change things. I've always been spiritual, but much more mystical. Like, I have no interest in organized religion, and still have very, very little. But who knows how it manifests with people. Like, I believe in a higher power. Like, when I look out at a day, I see it as a field of potential, energy that just needs to be ignited. And to me, that's God. That's the universe, this potential that needs to be activated by us, or whatever. And there is a sort of limitlessness to that, which might include the miraculous. What we call miracles might not be. I don't know.